In this lesson, we are going to see which are the most important climate-related diseases that traveler may occur into. You will also learn how to behave properly and take precautions in different climate conditions. Travelers, especially when moving to remote or simply far areas, can experience a lot of changes in environmental conditions. There is a variety of situations where drastic and fast changes may have huge consequences on their health and well-being. During their journey, they may experience major changes in altitude, temperature, and humidity. The first big difference is between cold places and hot places. You have to consider that the risk you can encounter and the precautions you need to take are different. Hot climates and temperatures can make you sick. This could happen especially if you are not accustomed to the heat, but could also depend on wrong behavior, like performing strenuous physical activities in presence of hot weather. If you have to do some outdoor activities in hot climates, it is better to take these steps to prevent heat-related illnesses, injuries, and deaths. Drink plenty of fluid, wear lightweight, light-colored clothing, do not forget sunscreen, practice outdoor activities when temperatures are mild during the day, rest often, and try to stay in the shade when outdoors. Before leaving, try to practice exercise in the heat 1 hour per day if you know you are going to enjoy strenuous activities during your trip. Which are the events you can meet if exposed for a long time at high temperature and humidity? In regions with high temperature and humidity, overheating can result in heat exhaustion or heat stroke. Heat stroke occurs when the body is no longer able to disperse heat by sweating. The initial symptoms of heat strokes consist of malaise, weakness, sometimes intense thirst, dizziness, nausea, vomiting, headache. Sweating stops and the skin becomes dry, warm and reddened. In severe cases, it may appear high fever, confusion and coma. To prevent heat stroke, it is advisable to avoid long walks and strenuous exercise during the hottest hours. Eat moderately, drink in abundance, having possibly the foresight to add a pinch of salt to water, and avoid alcoholic beverages. In regions with a dry climate or high altitude prevails the risk of sunstroke due to the solar radiation hitting the head, causing strong headache and confusion. To prevent sunstroke, it is very useful to use a wide-brimmed hat. Irritation and infection of the eyes and respiratory tract may be consequences of exposure to hot, dry, dusty air. Another risk associated with high temperatures is represented by dehydration. It can pass unnoticed, especially if you are staying in places with windy and dry weather. In this condition, in fact, it is possible not to feel the increase of sweating and not to perceive thirst. The spillover risk of dehydration is represented by the decrease of eliminated water, which is manifested with reduced production of urine, constipation, and poor sweating. In these cases, for preventive purposes, it becomes indispensable to take plenty of fluids supplemented with salts, sometimes even several liters per day. Talking about cold and hot climates means also to deal with risks connected with sun exposure and altitude. To prevent burns and damage from ultraviolet radiation, it is advisable to have a good pair of sunglasses. Expose gradually to solar rays using, especially in the first few days, a high-factor cream protection and cover the most sensitive areas, nose and lips, with ointments based on zinc oxide and titanium dioxide. Remember that exposure may suppress the immune system, increase the risk of infectious disease, and limit the efficacy of vaccination. In case of simultaneous use of insect repellent, the protection provided by sunscreen can be considerably reduced. Sunscreen needs to be applied first in order to obtain the cutaneous absorption. When dealing with high altitudes, especially for occasional walkers, the most important rule is to never rush the ascent. When approaching altitudes above 3,000 meters, it is advisable to include a few days of acclimatization and not to exceed more than 600 meters in altitude in the same day. Hikers who undertake rapid ascents exceeding large differences in height above 3,000 meters may incur in acute mountain sickness, which is manifested by headaches, loss of appetite, easily tiredness that might be aggravated by a sense of confusion, dizziness, vomiting, breathing difficulties. When facing with recent symptoms, it is essential to descend rapidly at lower altitudes, rest, and possibly seek medical advice. Travelers moving to cold climates face many risks, such as risk of hypothermia and freezing. Several loose layers of warm clothes are a good protection against cold weather. Wear gloves on your hand and a hat to protect your head. In wet conditions, shoes should be waterproof and have a good traction. Hypothermia happens when your body temperature drops below 35 Celsius degrees. Mild hypothermia can cause you to feel dizziness or confusion, and this can lead to misjudgment, make you think everything is right, and cause you to make mistakes, even deadly ones. Shivering is an early symptom of hypothermia, but if you keep losing heat, shivering, which is another symptom too, may stop. Your skin color can turn blue, and your pulse and breathing can progressively slow down until you pass out. This is important, especially if you want to join adventure activities. It is crucial to be well equipped to keep yourself warm and dry. When a part of the body freezes, damaging the tissue, this is a frostbite. If the tissue can be saved, the damaged part could be amputated. Some parts of the body are more at risk than others, such as fingers and toes. Warning signs of frostbite include numbness or tingling, stinging or pain when you are most exposed to the cold. Frostbite can be prevented by modern clothing, so they occur when there's poor planning and in severe unexpected weather. So, when you're traveling, don't underestimate climate conditions and be well equipped.